As India continues to see alarming surge in COVID infections, a record spike of 3,79,257 fresh cases has been reported in the last 24 hours, 3,645 deaths during that period. Over 1.8 crore people have contracted the virus so far, and hospitals and crematoria are overwhelmed amid the uptick. India has been recording over 3 lakh cases every day for over a week now, and more than 2 lakh cases are being reported since the 15th of April. It's the second day we've reported over 3,000 deaths. A shortage of hospital beds, medical oxygen and crucial antiviral drugs has added to the difficulties that is being faced by COVID patients and their families. Now, the next phase of the vaccine drive is going to begin from the 1st of May, when vaccinations will open up for all those who are between the ages of 18 and 45. While the registrations opened yesterday, not many were able to book a slot for the vaccination. That means taking an appointment. While they could register, not everyone could actually book a slot for their vaccination. So what is the realistic picture? Will people who are over 18 years of age actually be able to get vaccinated starting on Saturday? Well, several states have claimed a shortage and have reached out to the Centre for Assistance, as many claim they have stocks that will only last for a few days. And remember, this is even as those who are over 45 years of age are still getting vaccinated, many of them due for their second dose as well. States like Maharashtra, Chhattisgarh, Odisha, Andhra Pradesh, Jharkhand and Delhi have also complained that they are facing a shortage of vaccines, while reports are emerging from several other states that vaccine centers were being shut early, or people were being turned away due to supplies running out. So a big concern going forward on the next phase of vaccination. Now, on the issue of vaccines, remember, we are adding one more vaccine to our kitty soon. That is Russia's Sputnik V vaccine. But news coming in now that Brazil's health panel rejected the Sputnik V vaccine, saying it found worrying pieces of information about the vaccine's manufacturing process. They cited lack of quality control and efficacy data, little if any information on the adverse effects. Sputnik, however, has hit back and called the decision politically motivated. Meanwhile, India is expected to get its first batch of the Sputnik vaccines on the 1st of May. Remember, Sputnik is only one of 3 vaccines in the world, along with Pfizer and Moderna, with an efficacy of over 90%. In fact, its trial was published in the Lancet, and so it has been peer-reviewed. It was given regulatory approval in India on the 12th of April. Well, to talk about all these issues, we're now joined by Dr. Puneet Mishra, Professor, Center for Community Medicine, AIIMS, Dr. B.L. Sherwal, Director, Rajiv Gandhi Super Speciality Hospital, and Dr. Aparna Jaswal will also join us, Director, Cardiology of Fortis Escorts Heart Institute. Thank you so much, doctors, for taking time out to join us. Dr. Mishra, first and foremost, tell us about this, news coming about Brazil rejecting a Sputnik V vaccine, Sputnik hitting out and saying that it's a politically motivated decision.
See, as a scientist and as an academician, what I'll say, I'll rely more on the scientific papers which are peer-reviewed rather than the news items. I don't know what are the basis for Brazil to reject this vaccine or having controversy, because in February there was a paper on this vaccine where it claimed 91% efficacy, and till the time I see there is some conclusive evidence on the Brazil's claim, I will go by the Lancet study. And I think in India, when this vaccine was recommended, there was a panel of experts who has seen all the evidences which are available scientifically in favor of this vaccine. So what a country says based on the news article, it would not be wise for me to comment on this vaccine.
All right. What the panel also said was that there were some quality control issues, that they were concerned that different batches perhaps had different sort of quality, and they were concerned that not enough quality control measures were in place. Dr. Aparna Jaswal, your views on this?
Yeah, so I would resonate with what Dr. Mishra has to say, that we must understand that Sputnik V actually has been tried in 3.8 million Russians and has shown a sustained good efficacy of about 97% in them. And as he rightly said, that we must follow evidence-based medicine. Speculation is something which we should not spread around. I think the agenda should be very clear and well taken, that it is the vaccine which is eventually going to protect us from this disease at large. So we must ensure that we convey the message loud and clear that we really don't know what has gone in on Brazil, but we are quite confident of this vaccine just as we are of the others.
Right, absolutely. And we must point out here that it's being used in dozens of countries all over the world. It has received that emergency use authorization. Dr. Sherwal also joining us. Now I'd like to focus on our own vaccination process and the fact that the next stage of vaccinations is going to begin from Saturday. But is it really? Because a lot of states are citing vaccine shortages, that they have a shortage of doses. Dr. Sherwal, what is your view on this? Do you think that we are going to be able to open it up, or do you think it'll still take a few days before the vaccination drive really opens up to those below the age of 45?
Yeah, it will depend on the number of doses we have in the stock. Definitely, if we have the number of doses state-wise and particularly in Delhi, and I think then we can start from the 1st of May. Now we need to get it tested. If there are not appropriate doses, then definitely there may be some restriction, or maybe some day, maybe 1 or 2 days.
Right.
Otherwise, no short.
Yes. Right, Dr. Mishra, now this is a big concern because this is the only way we're going to really, counter this, the manner in which this pandemic is now spreading in the country, the second wave, which is being described as a tsunami. If only we can get more and more people vaccinated. So a big concern about doses, given that lots of states have complained that they simply don't have enough right now.
See, you should understand that we cannot vaccinate whole of India in 1 day or 1 week. It's a very big country. There might be some concerns about the doses, and basically health is the state matter. So the state government, they may be knowing better what is the condition in their state and what are the problems. But as far as the government is concerned, if you see, earlier there were 2 vaccines, they were licensed. Now there is one more vaccine has been licensed, and there are few which are in pipeline. So in coming days, I think both vaccines would be there and supply would be better. And in the meantime, we keep on, vaccinating people with the vaccines which are available. The other thing is, along with the vaccine, the equally important thing is, which people should understand and media should highlight, is COVID appropriate behavior. That is equally important. So there are 2 things. The infection is quite high in our country right now. So there is a burden on the healthcare system to treat those people so that we can reduce the number of deaths. Number 1. Number 2, we have to, follow the COVID appropriate behavior so that in the meantime, when we are giving the vaccine to, people who are above 18, that will take some time. So these are the messages that along with the vaccine, continue COVID appropriate behavior, and that should be strictly adhere to, because a lot of people, they are taking it very lightly to use a mask or to maintain the social distancing.
Right. Dr. Jaswal, now, in the first few phases of the vaccination drive, we did have a challenge of vaccine hesitancy. Do you think now we're beyond that? And the main worry is a shortage of vaccines. We're going to have enough people who are coming forward, especially given the kind of crisis we're facing, over 3 lakh cases being reported every day for over 8 days now.
So I think this is a very, very important point you bring up, because even today I receive calls from my patients who are beyond 65 asking whether they should go in for a vaccine. They still are not confident. So I think it's imperative that we use this platform and spread good communication and let people know that there should be good public confidence in this vaccines. I think it's very important that along with COVID appropriate behavior, which is the first and foremost, as spoken by Dr. Mishra, the next most important is that there has to be confidence of people in the vaccine. We are seeing a rush suddenly because there has been a surge of the disease process, but it's important that everybody understands and be confident that they keep calling us asking which one to seek. It's not a question of which one to seek. I think the awareness should be there that we have to vaccinate each one of us at the best. Also, I would like to highlight that while we are discussing the shortage of the vaccine, it's important that the people who are beyond 50 should essentially be vaccinated, because should they have the disease, they will have a much more significant disease. So let this message be clear that we have to take the vaccine, and I'm sure we'll be able to counter it.
Right, and there is a concern among the elderly when they go in for the next, vaccine dose. Should they face massive crowds? Already we saw scenes in Mumbai in which, there are long lines of people waiting to get their vaccine done, and many are trying to get it before Saturday. We have a caller now. We're opening it up for questions from our viewers. Jogeshwar Rao calling in from Hyderabad. Go ahead with your question.
Good afternoon, Gargi and team of doctors. My question is about the duration of protection after I take both the vaccines, both the doses of vaccines, and after 2 weeks. What is the duration of protection I will get? If that duration is short, within months or even 1 year, is there going to be further series of doses?
Right, Dr. Sherwal, will you take that question?
Yes, as of now, whatever vaccines are available, the efficacy and the duration which we are talking about is usually say 6 months. But as the more and more studies will be there, we will be able to comment that whether it is lasting more. Because now the vaccines are new and disease is new, so we have data only not more than this month period. So if we say that it will be effective for a year or it will be effective for 2 years, it is not possible at this junction. So, but I will say that if it is effective for 6 months, that is good enough. And already their co-vaccine, there was talk that another booster after 6 months is also being thought to give. So that is a different, strategy.
Right, people shouldn't worry right now about, yes, it's going, as you said, we only have very limited data. Vaccinations have only begun a few months ago. And yes, all of you doctors, encouraging people just go and get the vaccine for now. At least you'll be protected against severe disease. We have another caller, Harpreet from Gurugram. Go ahead with your question. Right, Harpreet, can you hear me?
Yes, I can.
Yes, please go ahead.
Yes, good afternoon, everybody.
Good afternoon.
I just turned COVID positive roughly about 2 weeks ago, and now I'm recovered 2 days back. I've been tested negative, so I've recovered. I have elderly parents at home, so I am interested in getting my vaccination done at the earliest. Is it advisable, considering I've just recovered recently, that should I get vaccinated?
All right, Dr.
When should I get
Mishra?
vaccinated?
Okay, so your question is that you had COVID positive status 2 weeks back and now you are recovered, you don't have any symptoms. If you don't have any symptoms and you are fully recovered, minimum 2 weeks after the recovery. So that is a total weeks from the time you became the COVID positive. So 2 weeks has already passed, and wait for at least 2 more weeks before you can take the COVID vaccine.
All right, so you should wait at least 4 weeks if you've already experienced the disease, and then go ahead and get vaccinated. Is there any worries if someone gets vaccinated sooner? Suppose someone has had an asymptomatic case? Dr. Mishra?
Question to me?
Yes.
Yeah, so what's the question? Yeah.
No, are there any risks if you get vaccinated sooner, if you've just recovered? Perhaps the person wouldn't even know if they've had COVID. Sometimes that's also
So, a very important question. See, if person doesn't know about the COVID status, then we can't help. But the thing is, if a person got this COVID infection and go for the vaccination too early, there might be some interference with the antibodies which are present. So the optimum period we say, there are certain studies which say, okay, 4 to 8 weeks. But at least 4 weeks should be there so that we get the good efficacy of the vaccine after this COVID infection. That is the reason behind this logic.
All right, so that is a concern that, many people would have. We have another caller with us, Tanuja, calling in from Jamshedpur. Go ahead with your question, Tanuja.
हेलो
जी बोलिए.
हाँ सर, मेरे जिया जी है अरुण नंदा जी, उनको कोविड पॉजिटिव है सर. वो उनको निमोनिया हो गया है सर. तो वो कम से कम 10-15 दिन हो गया सर, और बहुत सारे हॉस्पिटल में लेकर घूम रहे हैं. तो निमोनिया मतलब ठीक होने का कितना चांस है सर उनका? और वो ऑक्सीजन लिए थे तो ऑक्सीजन खत्म हो गया, तो सब हॉस्पिटल इधर से उधर रेफर कर रहा है. तो क्या कर सकते हैं सर? मतलब निमोनिया को कितना हो गया हमको तो पता भी नहीं चला, और ठीक करने का उपाय क्या है सर? कुछ नहीं मालूम हो रहा है.
All right, a very concerning situation. Dr. Jaiswal, she's saying her brother-in-law has COVID and he has pneumonia. It's been over 10 days, I think is what she said. And she's very concerned and they're getting treatment at various hospitals. But again, I think she was saying that there is some sort of a shortage of oxygen.
Yeah, well, I think this is a very, very sad question that I am having to answer. But importantly, I think how I can guide her is that she must seek guidance from one doctor who is qualified to treat, either it could be an internist or a chest physician, and seek proper treatment and follow the medical advice of that doctor appropriately. One point that I want to make here, I think, which has really come out is the position of the patient when they have pneumonia. And let me take this platform that let them understand what is awake proning, and while we are battling the disease and lack of beds, what we can best do is, I'm sure if she connects with the right doctor, giving good antibiotics at home, home-based steroids if the need is arising for the same, and at best awake proning, and if she can be admitted, I think that would be best. But let me just take this platform and just 1 second, Gargi, I will say what is very heartening is while we are discussing such an important subject on this very show, I can see on the lower what is flashing is that some MLA's son has had a big fat Indian wedding. I mean, here we are trying to battle, our colleagues are dying, we are battling this in hospitals and losing our loved ones. I think it's time that COVID appropriate behavior really entered all of our heads, otherwise everything is going to be futile.
Absolutely, and that's a very shocking story, and really shame on authorities there in Bihar when an MLA's son managed to have such a massive wedding with no sort of COVID appropriate behavior, and it went on beyond 10 p.m, which is what the rules in the state are currently. We have time for one last caller, Rajni calling from Pune. Go ahead with your question, Rajni.
Yes, please. Well, it has been observed that most of the vaccination centers conducting the vaccination drive, the citizens are required to take the lift and go to an enclosed place, stays upstairs, on higher floors. So my question is, can this not be conducted in the open space which is around the hospitals or in the parking lot of hospitals, so that the citizens are not exposed, to the possibility of catching an infection?
All right. Well, that is a concern that many people have about, going to these crowded vaccine centers. Dr. Sherwal, do you think there's some merit to that perhaps, hospitals could think of doing it in the open?
Yes, the practicability has to be worked out, and it seems good. If we have the space and if we have the logistic, definitely we can do it.
All right, but as I said, a lot of people have concerns regarding that, especially elderly when they go in for their vaccinations and there are huge crowds over there. Well, that's all the time we have on the show for the questions from our viewers. Thank you so much, doctors, for taking your time out and joining us and, answering all those questions very patiently. Well, with that, time for us to slip into a short break. We'll get you more news on the other side. Stay with us. Welcome back. As India is undergoing this crisis due to the second wave of COVID, and there's a shortage of a lot of essential supplies like oxygen at this time. Now, several European countries have also offered to help India with aid and supplies. To talk more about this, we're joined by DW's Thomas Sparrow, who joins us from Berlin. Thank you so much, Thomas, for joining us. EU countries, including Germany, have pledged to send aid to India. Could you give us more details on what exactly is being sent?
German Chancellor Angela Merkel stressed earlier this week that Germany was urgently preparing a mission of support to India, focused in particular on providing medical equipment or oxygen. And the German Defense Ministry, for instance, reportedly said that it was assessing the possibility of providing mobile oxygen generators. At the same time, aid is being pooled at an EU level through the so-called EU Civil Protection Mechanism, and the head of the European Commission, Ursula von der Leyen, said that a first shipment of oxygen, medicine and equipment would be delivered over the coming days. And what this concretely means is that the EU will be delivering oxygen concentrators provided by countries like Ireland or Romania, ventilators provided by Sweden or Luxembourg, or antiviral medicines provided by Belgium or Portugal.
All right. Meanwhile, Thomas, the row between the European Commission and AstraZeneca continues, with the Commission launching a legal action against the company. What exactly is the issue of contention?
The European Commission said it had launched legal action against the UK-Swedish company AstraZeneca for breach of contract after a number of delays in supplying coronavirus vaccines to the EU. A spokesperson for the Commission said that all 27 EU members had backed the move, which comes after, as the spokesperson said, some terms of the contract were not respected and AstraZeneca had not presented a reliable strategy to ensure that doses were delivered timely. It had previously been reported that some European countries, including Germany, had been initially reticent to sue AstraZeneca in particular because of concerns that the move might not speed up deliveries. Meanwhile, AstraZeneca responded by saying that it had fully complied with the agreement and stressed that it believed that any litigation is without merit.
All right, Thomas, thanks so much for joining us with the latest from there. Well, that's all the time we have on the show. We leave you now with this message, which was put out by Priyanka Chopra, where she asks the world to come to India's aid.
Why do we need to care? Why is it so urgent right now? I'm sitting in London and hearing from my friends and family in India about how hospitals are at capacity. There are no rooms in ICUs, ambulances are too busy, oxygen supply is less. Crematoriums having mass cremations because the volume of death is so much. India is my home and India is bleeding. And we as a global community need to care. And I'll tell you why we need to care. Because unless everyone is safe, no one is safe. So please use your resources and focus your energy on helping stop this pandemic. Please donate. And I understand a lot of people must be angry and thinking about, why are we in this place in the first place? Why is this happening? Well, we'll address that. We'll address that after we stop the urgency. Please donate and please use your resources as much as you can. India needs you.